Next level hospitals, revolutionizing patient care. That's the panel about. And we have moved now in the past couple of, let's say, 5 to 10 years to age of digitalization and health transformation in hotspots of healthcare, like in Finland. We are great about that. We are great, but there are so much to do. We have moved from age of experimentation to age of adaptation, you could say. But many of the solutions, as well as the data, is siloed or creates silos. And we have actually 3 kind of issues today what we discuss about, and those are how to find a correct balance between inpatient and outpatient care, what is done in the hospital, what outside of the hospital, where we live our lives and collect the data for decision making. Then the role of data, and at last, how to manage the transformation to put these new beautiful solutions in the impactful use. And we have here excellent composer of the panelists because they represent startup entrepreneur, head of division from University Hospital, and then Kymenlaakso area, chief digital officer. So let's start by introductions. So guys, name what you do, what's the background, what you do, that's about it. Sally.
So my name is Sally Järvelä. I come from Tampere University Hospital, where I'm a head of division, and we have more than 150,000 patient contacts in our emergency services, and also I run ICU and anesthesiology, and then the Department of Accidents and Emergencies. And I'm here representing the evolution, because in public sector we are not doing revolutions.
Yes, hello. My name is Maria Lavonen. I'm the CEO of Vivaco, and we are specialized in digital health solutions to have a patient-centric care, measurable information, real-time information, and solutions to share information across the healthcare providers, users, and the relatives. And I've been working with the healthcare technology more than 15 years now.
Okay, my name is Matti Ahola. I'm the CIO, Social and Health Services in Kymenlaakso. So we have now started our new sote-alue, sote district. And today I want to share my experience how the data should be organized that we can get better services for our customers.
Okay, then let's get started. And how we can find the way to develop better sustainable solutions to push kind of the focus for our outpatient care, that we can take care of everybody and do the necessary things in hospitals. So how you deal with the balance between inpatient, outpatient care now, and where are we moving?
I think at least in public sector, our biggest problem is that we are asking a lot of hows when we are thinking about digital transformation, when we should be asking why. And if we ask why, then we ask if this is going to add up to the patient or to the doctors or to the nurses who are doing the work. So I think that is one of the challenges that we have to realize. It's only digital, but it's not digital transformation if we are not asking why.
Yes, very good comment, because it's really the digitalization is about the sharing the information about the patient. And I think that if we are thinking about the moving from the hospital to the outpatient care, the information flow and the understanding of the information is the most critical thing. And there is 2 things. One is naturally the safety of the people at home when they have rehabilitation discharge from the hospital. So are they is there need to come back, or is there need to have the consultation? And also that you're in hospital, you know also that what is the status of your patient at home when they have been discharged. I think that that's the crucial, so we can really automate the information, and the information is then moving so that really the patient can be at home earlier than in the older systems.
Good comments, Sally and Mari. And Aki asked about the outpatients. We know that social and health costs increased every year 5%. And where does it come? We know that the care of older people is the biggest challenge for us. And I have to say that in the future, we are not anymore talking about hospitals. Hospitals are spreading around, so we are actually emphasizing the outpatients very much. So that means that we are not increasing IT system to hospitals. We should cover all the districts. So that is very important in the near future. And we need this digital transformation to manage it.
I have one concrete example on this. So elderly people who have cognitive heart failure, the one measurement very easy to do that connects straightly to the state of the illness is their weight. And they can measure it every morning. And if they would be able to deliver that data to the doctor or to the nurse, we could see that, all right, now it's increasing, so the heart is not pumping as effectively as it should. And then we could actually intervene more early. So when it's gone too bad, it makes the elder people to come to the hospital inpatient, being in ward for 1 or 2 weeks. And it's really easy to follow. So we already have knowledge, but we don't know how to use it.
Yeah, what Sally said, it's very important to set up preventive services. So we have to be on demand when we are serving our customers.
And then, what could be then, if we look at the services, kind of implementing new services, what would be a good example of like how we deal with the issue now, and for example in 5 to 7 years from patient perspective, before a hospital visit, during and after, or when to recall the patients early in, or during the follow-up.
Yeah. When I meet my patients, one of the things that they complain a lot is that the last doctor or the doctor before them was too busy. He didn't examine the patient, and he didn't have time to have the contact that is crucial for the healing, because it's always a connection between the doctor and the patient. And even if we have digital or AI, we cannot outsource empathy and the connection that we need. So I think that I would like to use my time with the patient only to discuss with him and examine him. So if he could provide me all the knowledge that he has about himself beforehand, so the anamnesis of the patients would be already in my availability the day before. I could read it before, I would know the history, I would know the symptoms, I would know the fears that the patient had. So I would like in 5 to 7 years that my time would be the patient's time. It wouldn't be the IT time and the computer time, but it would be the patient time.
And you could kind of know already a lot when
Yes.
the patient comes in by the info what he or she has provided.
Yes.
Through monitoring combined with the patient history, and then focus on the patient.
Definitely.
And release the pressure.
Yeah.
Maria, how about the Pori case you did? Could you open up that? And what you do now at the Pori area with thousands? Thousands,
yeah.
and where you moving, like what it will be in your imagination in the next 5 years?
So at the moment in Pori district, they have more than 1,000 home care customers at home, and Pori hospital is actually following real-time online continuously the state of the person's well-being, and if there is change in the well-being, so which means typically activity drop, daily activity drop, or then the circadian rhythm is changed badly, it means that the health condition and the functional capabilities decreased. They will receive immediate alarm, and they will actually contact the home care customer, and they can call or they can visit. And the idea is that they use this yellow and red-black information in order to cope that in the daily time and avoid that the situation is worsened and the patient is then next evening at the acute care.
Yeah.
That's the idea.
And Matti, like at the same time moving to the next thing, data, like from your point of view, when you manage and define the new data systems and so on, what are taken to use? How it's working now? You have one modular system which makes it work pretty well, if you can tell about that, and what it is in your kind of head in the future. What would you like to have to optimize resources then?
Yeah, now Sally gave a very important requirements for IT. So Sally wants to interact with customers, not with computers. And then Maria has the technology. And actually, in Kymenlaakso, we have a very good pace to leverage these IT services, because we have one single healthcare information system. So we have one single customer system, and then we have another system where we manage all the resources. So this is the lesson which I would like to say to you all, that in your areas you have to have political leadership to make bigger sote districts. If you don't do it, you are always in that situation what Sally says. So what we are doing next? Now we have resources, and then we have the customer information system. We are trying to build up these information systems, data lakes. So because in our strategy we are trying to build preventive interactions, preventive services. So we need a lot of computing power, we need data lakes, we need to analyze big data so that we can be proactive, that we can give services on demand. But you always have to do in your area this basic work to combine many information systems to a single one. Then we can set up these high-end systems like Maria is presenting there. So preventing service is the strategy for KymSote, and of course we are trying to use data much more better using these data lakes. And I wouldn't ever emphasize enough that customer interaction, it is the most important thing which we all should better in the future. So we are today discussing about data transformation. I think the most important thing is the transformation which you all do in your own hospitals and SOTE areas. So you should to change your attitude, and you should emphasize the customer interaction, not the IT systems.
Excellent. And digital health at best is that it's on demand, easy to use when you need it. then you don't visit the doctor when it's not needed, and kind of recalling med easy and so on. It changes like way we work, as we have heard. And what kind of cooperation you do, and what is the ideal composer if you start to implement new services like cooperation between companies, clinic, and end users?
One of very good examples of how it could be done is Nona. Nona is a service for cancer patients where they can actually inform their daily pains or their symptoms, and they can have data from their illness from there. And actually that's very good surface point between the patient, between private corporation, and between the hospital. So I would like to see more Nonas in our field.
And how is it work for you and Vivago, kind of cooperation between healthcare professionals and end users? Like what are the innovation loops you have?
So first of all, for the end users, the system should be as easy as possible to use. So actually as automatic as possible. And for us, for example, it's been really key of the design. Then of course the second thing is that we are not providing the technology, we are providing actually the solutions for the healthcare providers to change the processes and change the culture. Because the key thing is that when you have this kind of real-time measurement and monitoring, it's a new way of sharing the data and using the data similarly than with the Nona. So you get the measurement, you get the information, and then you have the access from the nurses, physiotherapists, and of course also the doctors. For example, doctors can do the decisions of changing medication, for example, or then inviting that, okay, now I need to see this patient.
So, and you all are involved in this digital transformation and implementing new services, and then when we look the transformation, it all comes down to culture, like way of thinking. What are our values as workers and professionals? What are the stigmas we have? We are very busy. Doctors very busy. What is their willingness to take into use new services, so on. Say Matti is battling with the politicians and legislation and making sense of everything. So what are the concrete challenges in daily work? Because you have loads of doctors kind of who you serve as the head of division.
Yeah.
How you empower them and get new solutions in place.
So when we get new solutions, I promise them that when we take the new solution, there is a learning curve. So during the learning curve, we have to do the same with our kids. We have to teach them. We have to teach the technology and we have to teach the AI. But that is something that starts from here and ends sometimes. So it should be working in 2 or 3 weeks. And when we take new technologies, I tell them that I will ensure that it will work in 3 weeks. We have a period of discomfort, but we will make sure, when they tell me that they have problem because of this or this, we will make sure it's not problem tomorrow anymore. So when we start something, they have to see for example, of course they have to see the demand and the need for that beforehand, but then they have to see that we all are working to make it work.
And have a promise and resources and a time for that.
Yes.
Because and find the kind of inside of the organization those torch flyers who promote that further and sell it to customers and inside of the organization.
And I think the most crucial thing is that it has to be something that they have been telling they have problems. If I just tell that now we have this fine technology, let's use this, it means nothing to them. It has to be that I have been hearing what they tell, that every day they have problems with patients or the data or something, and then I have to do something about it. It's not that we just take some fancy technology and then we want to use it. It's something that they have to need.
Yes, and as Sally, you said, it's really about the leadership, that you lead the new systems into the use. And of course, the second thing is also the training is very, very important, that there is the understanding that how to use this and what makes the information and what is the reason. For example, that this provides more safety and also the preventive information, that you can get really the better patient-focused care, for example. So you get the commitment both from the nursing staff but also from the users itself. And it's very crucial. And that's one of the important things with us also and with our solution, that we have the usage rates more than 90% when they have taken into the use. Naturally, some people don't want to use, but almost everybody wants, because they see that there is both safety reasons and also the better care.
Maybe in Kymsote, I think the most difficult thing is to find out what is the most important things where we have to invest. We know that we have to have preventive actions and services, but still we have to study it more. What are the first things which we are going to build? And I have to say that it's not anymore IT. It's just knowing the customer base, knowing the hospital, how it works, and such things. So I have to say that we have all the technology now, but maybe we don't know exactly how we should use it today. And I have to say that always we have to have the basics in order. If we have some problems in our basic patient information systems, then we don't have time to build these better services which we are now talking about. So put your bases in order, then you have time to leverage better services.
So then maybe to close with your all expertise, your legacy, and what you've done, and when you look further, because you are through health transformers, kind of trying to make it hard. If you would be gentle dictator, kind of combination of prime minister, health social care minister, and you could nail down one thing that you could give a command how we work or what has to be changed, what would you do? That it would happen, when you say it with the magic wand, that it would happen. What is the thing what you would change to make health transformation happen?
I think I would hope that we can overcome the professions. That, of course, I want that the top surgeon will operate my kid if my kid has a problem. But what I mean is that we move from professions to tasks and skills and talents, and we learn to use them. And one of the things that I would really hope is that we would use the data to solve the problem with the over or under treatment. I think that is the one thing that costs the most in our system.
If I'm looking at the digitalization, actually it will bring much more new information also about the normal patient care, because using the digital tools and solutions what we already have available today, it's more like taking them into the use and then learning about that this type of person, there is the trauma patient, you need to improve the care with the steps that you learn from the digitalization. And in Finland, if I'm thinking, well, we have this society that we have a lot of technology and a lot of bright systems, but it's really about the leading the systems into the use. So out from the scattered patient data systems to the to the more combined inherent patient data and the use of the digitalization tools, access from the video to the home, having the real-time data from the home to the hospital, and then so that it's really in the use of the people who really need that information.
And if we can get these things, I would like to see much better political leadership in Finland. So look at what we have done in Kymenlaakso. We have founded Kymsote, and we have got a very good political leadership there.
What I think we have 13 seconds is that I would love to see kind of the debates where are the best chief innovation officers from different areas of that country in place. They are best forward-looking doctors, entrepreneurs, startups, corporations, and patient groups going all the time the discussion what works, what doesn't work, and stop doing all of those things what doesn't make sense, and start to do things co-creative way what makes sense. So maybe next level hospitals are the hospitals which stick like never before, can serve the patients in a patient-centric way and meet them in person. They are backed with the data, with beautiful with the beautiful diagnostics and so on done in a hospital, but most importantly from what we collect from home. And many of these things, daily issues, relieving the pressure, pain of being with the condition, could be done through telemedicine, kind of access to care as easy as possible. Is it like that?
Yes.
Something what I have learned.
Yeah.
Good. So hey, big hand to panelists. Go and talk to them during the day, and hopefully you enjoy the two good days coming up, and meet the one. So discuss with at least 5 persons in a way you engage them and learn from them, because this is what all events are all about. Learning from persons with the different backgrounds, and then change ideas what work, what doesn't work. And if you find the one with who you're gonna do something concrete, perfect. So thank you.